Thank you for watching KTN. Welcome back. This is Weekend Prime. Now, Kenya's pursuit of universal health coverage has evolved over the years, but by far, the boldest move in this quest was the overhauling of the country's healthcare system. The Kenya Kwanza administration has banked on these changes in the sector to deliver the elusive health agenda that seeks to ensure quality, accessible and affordable healthcare. But 2.5 years later, since it ascended to power, has President William Ruto's regime lived to its health promise? That's what Gloria Milimu interrogates on this episode of Health Digest. Take a look.
The Grand Coalition government made an attempt on universal health care, and we didn't succeed. The Jubilee administration made an attempt on universal health care. It didn't work. We are not going to fail a third time.
A firm promise that morphed into a raft of measures in the country's healthcare system, resulting in the birth of the government's ambitious Taifa Care program. 6 months later, after the Kenya Kwanza administration embarked on its ambitious goal to deliver universal health coverage through the Taifa Care program, the transition has had its fair share of wins, however, still faces a myriad of challenges ranging from financial gaps to infrastructure constraints, among other teething problems that continue to hamper service delivery.
Health sector haifanyi kazi, na hiyo iko witnessed na wale watu ambao ni key partakers ama stakeholders ama the clients, the consumers of your service.
When you look at the Kenya Kwanza regime on what has happened from August 2022 to now we are in April 2025, I will confidently say that the performance is below par.
At the core of this concern is the delivery of the regime's manifesto for health that is pegged on 4 pillars. They include realization of a social insurance scheme that covers all Kenyans while ensuring that no one is left behind, lowering the cost of healthcare by encouraging local manufacturing, enhancing primary healthcare services and data portability to help strengthen data-driven decision-making for better patient care and resource allocation.
Theoretically, the Kenya Kwanza manifesto was sound and it gave hope and promises. But in the practical implementations, it is quite devastating.
So much so that many patients continue to incur out-of-pocket expenses despite the promise of affordable health care.
But now we are in a situation where you go get the services in public facilities and you're being told to top up.
And no one knows this better than George Gibore, who is among the team that helped draft the ambitious Kenya Kwanza Health Manifesto.
We came up with a document that if today was implemented to the latter, every Kenyan will enjoy services. We will not be talking about lack of enough of staff.
The regime has also grappled with reimbursement delays from the defunct National Health Insurance Fund, leaving facilities in financial distress. Similarly, the contribution structure is among issues that experts raised concerns over, calling for refinement of the system in order to ensure fairer contributions, especially for low-income households.
For the first time, every Kenyan, even those who today cannot afford nothing, they will have a health insurance.
Concerns about sustainability of the new health scheme are also significant. Experts argue that the 2.7% contribution by members is disproportionate to the benefits offered.
We're just gonna carry on with the treatment.
On the other hand, the Social Health Authority announced that it has improved some of its benefit packages. They include the critical care and oncology package, which took effect this month. Each patient will now have access of up to 550,000 shillings annually for cancer management, according to the authority. Reimbursement of critical care services has also been expanded from the initial 4,480 shillings per day to 28,000 shillings per day. However, of the 22 million Kenyans registered with the authority, only 4 million are actively contributing their monthly payments to SHA. 3.5 million of the active contributors are salaried employees whose contributions are automatically deducted, raising more questions regarding the scheme's sustainability.
Most of the suggestions we gave to the Kenya Kwanza government is that they should move from that contributory aspect, or the labor income tax funded kind of a healthcare system, to just a general tax.
We've also seen a situation whereby, for the first time, the budget of healthcare is actually dwindling, is reduced every year, to the point that this year it was reduced by 70 billion.
The recent Auditor General's report that raised concerns regarding financial transparency involving the government's decision to allocate 2.5% of members' contribution to an escrow account are some of the issues that continue to dog the Kenya Kwanza's attempt to deliver UHC. The Ruto regime also promised to prioritize local manufacturing as a key driver of UHC, and this has also come under sharp criticism. Whereas its midterm scorecard says 63% of Kenya Medical Supplies Authority products were supplied by local manufacturers, experts hold a contrary opinion.
One thing in the manifesto that is actually reality is that 80% of our drug consumptions are imported. Yes. And see, you cannot claim that you, in 2.5 years, you moved from 20% to 63% when you do not have any investment in the manufacturing plants that are producing the drugs.
On the other hand, the administration has recorded progress in enhancing primary health care in the country. The registration of over 100,000 community health promoters has helped strengthen primary health care services at the grassroots level. This has in turn, according to the midterm scorecard, seen at least 8.5 million out of the 12.5 million targeted households visited. Additionally, over 300,000 Kenyans have been referred for diabetes management, another 700,000 referred for hypertension assessment, and at least 100,000 pregnant women referred for antenatal care. Similarly, 6.9 million children under 5 have also been assessed for illnesses including malnutrition, diarrhea, malaria, and pneumonia.
Sekta ya afya ilikuwa na shida, lakini kwa wale some of our relatives wamehudumiwa, SHA inaendelea kufanya kazi.
While efforts are being made to achieve universal health coverage, they are still not enough, and they are painfully slow for patients who struggle to access or even afford healthcare in the country. These efforts must move beyond the conceptualization stage and be actualized. Anything less than that would be a slap in the face for hapless patients left to bear the brunt of a broken healthcare system.
To have confidence of Kenyans in healthcare system, you don't need to advertise it. They say they need to experience the services.
Gloria Milimu, KTN.
Now, as the world faces multiple climate